Gvoke glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Please see important safety information at the end of this video and full prescribing information at www.gvokeglucagon.com.
Macey's involved in a few things. Volleyball, horseback riding, and art are probably her biggest activities that take up time on her calendar.
And hanging out with friends, very social.
Yep, definitely.
Lots of weekend
trips.
plans, malls, shopping has become a thing, much to our, bank account
Yes.
dissatisfaction.
Not really happy about that one.
Macey is a teenager. She is definitely wanting to be more independent. In fact, for her 13th birthday, all she wanted to do was be able to go to the mall with her friends without me there. She was like, Mom, you can't be hiding in the coffee shop, down the hall.
Me and my friends, we all like to go to different places like the mall and go shopping and stuff. And then we'll go grab something to eat. My friends, they can just grab something and eat it, and I have to make sure I'm like, well, how many carbs are in this? Am I going to be running around after this? Do I need to bolus extra because I'm high? There's a lot more thinking.
When Macey was diagnosed with type 1, our world was turned upside down in the matter of a 20-minute car ride from her pediatrician to the children's hospital. And I think every parent who has a child with type 1 will attest to the fact that you're never gonna sleep the same way.
The goal, of course, is independence, right? And as much as I wanted to carry the burden for her, I would swap with her in a New York second. We really wanted her to understand how to do this and how to manage it because, I'm not gonna be able to hover over her forever. Balancing her desire for independence and also the need to keep her safe is definitely a tug of war every day. And we're learning as we go. We tried to educate Macey on severe lows early in a way that communicated the necessary urgency, but also didn't scare her. She was only 7. So we educated her on what glucagon was and when she should use it. We just tried to keep that dialogue open for her to ask questions. One of the most compelling pieces of Gvoke HypoPen for me is that she has the ability to give this to herself.
So recently I was at a sleepover and my parents weren't there and I was having a severe low.
In that moment, Macey's blood sugar was dropping so low and so quickly, she didn't have time. She needed to intervene with Gvoke HypoPen immediately.
Having Gvoke with me gives me the confidence to have freedom, like going to the mall or having a sleepover at a friend's house. Whatever bag that I have or I'm carrying during the day, I always have Gvoke in there just in case of a severe low.
I think the experiences that we've had using Gvoke have definitely given Macey confidence to intervene and to feel comfortable using it when she knows she needs to. And I'm really grateful for that.
I'm more the worrier of the two, a little more comfortable and knowing that she has Gvoke with her, and if there ever is a time that she needed it, either her or her friends could assist with it.
If she's away from us, she'll shoot us a text and say, I'm having sugar, or I know I'm high, I'm giving myself some insulin. So it's great two-way communication. She's assuring us that she's being responsible and, we're sort of saying, okay, you can fly here, but still stay close.
It's important to know what you're dealing with type 1 diabetes as I'm getting older, I need to learn how to do it myself because I'm not going to be with my parents and it's not going to be their responsibility for the rest of my life.
As a parent, it feels so rewarding to see your daughter approach a disease with no fear. I think in life we try to guide our kids and point them in the right direction, and while It was one of the saddest day in our lives for her to be diagnosed with it. I think it's really opened her eyes to what she can do in life. Yeah, she has this disease, but she plays volleyball, she rides horses, she's at summer camps. It hasn't slowed her down a bit.
Indication: Gvoke glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Important safety information: do not use Gvoke if you have a tumor in the gland on top of your kidneys called a pheochromocytoma because of the risk of a substantial increase in blood pressure, have a tumor in your pancreas called an insulinoma because of the risk of low blood sugar, are allergic to glucagon or any inactive ingredient in Gvoke. Stop using Gvoke and seek immediate medical attention if you experience any symptoms of a serious allergic reaction, such as rash, difficulty breathing, or low blood pressure. Before using Gvoke, tell your doctor about all the medicines you take and your medical conditions, including if you have not had food or water for a long time, prolonged fasting or starvation, have low blood sugar that does not go away, chronic hypoglycemia, or have a history of a skin rash called necrolytic migratory erythema, commonly associated with glucagon-producing tumors. The most common side effects reported in adults are nausea, vomiting, swelling at the injection site, and headache. The most common side effects reported in children are nausea, low blood sugar, vomiting, headache, abdominal pain, high blood sugar, pain or redness at injection site, and hives. Inform caregivers on the instructions for use of Gvoke and symptoms of severe hypoglycemia, which include unconsciousness and seizures or convulsions. Store in original container until time of use and at room temperature between 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please talk to your doctor and see full prescribing information and patient information guide for Gvoke at www.gvokeglucagon.com.